Hi there, my name is Sifiso Falala. I represent the African Genius Awards. Today we are very honored to have with us an African genius, Professor Mashudu Tshifularo, who was honored last year in 2024 with the very special award of African Genius, which he so richly deserves. Professor Tshifularo is here with us today. He's going to tell us a lot more about himself, the work that he does, but he's an outstanding individual, an innovator with numerous innovations, no less than 10, and we will be asking him to talk about his outstanding innovations. Among other things, apart from being a surgeon, a scientist, a professor, he is also an author. He writes books, but he's also a pastor. So it's quite a diverse background, but with his special mind and the capability that he has, I am pretty certain that doing such things is not a problem for the Prof. Prof, welcome.
Thank you so much. Thank you so much. I appreciate the welcome. And I'm looking forward to our discussions.
Yeah, so it's very difficult to, when I'm with you, I get so excited because of the work that you do, and you just got back home from a conference in Chicago. What was that all about?
It was a global hearing health. So we're talking about how to advocate for hearing world because of the pandemic of hearing loss that we are facing, and it's a very silent pandemic. Everybody has earpods, everybody's on cell phone, and everybody enjoy their music, but they don't know that they're damaging their hearing at the same time.
I think coming from you, I am going to certainly pay attention to that, because you see a lot of social media shorts, videos, talking about how harmful these earphones are.
Yes.
But as a scientist and somebody who's a specialist in the area, you are confirming that. Can you maybe tell us very briefly about what you call yourself professionally, because you have so many qualifications and you do such diverse, complex work in many people's eyes, and you spend a lot of time in theaters operating. I read the other day that you had operated on someone who was deaf and they received their hearing. In a nutshell, what do you call yourself? What are you qualified as? And when did you qualify? And what was your journey to getting there?
I mean, in a nutshell, I consider myself a servant of God who is fulfilling the purpose and the mandate that has been given to him. And my mandate and purpose is to cure, to heal, and to make a difference in people's lives. So I specialize as a medical doctor, and then I became an ENT specialist. I qualified as early as late as 1987. I was a medical doctor in the University of Natal, which was one of the only two universities, actually one university which was dedicated to train black African specialists. And it used to be called Black Section, University of Natal Black Section. We were in a barracks. So from first year to sixth year, we were not more than 700 blacks. Anything that was not white was there. Indian, colors, male and female, doing whatever course in the University of Natal, BCom, law, medicine. We were not more than 700. And so to get there was a privilege and an honor, a very, very special thing. So I trained there in 1987. I was among roughly 14 blacks in that class. And out of that class, three of us, one of them is the late Professor Mayosi. I'm sure you know him, the cardiologist, may his soul rest in peace. And another one is a dermatologist, Dean, a professor in the University of Natal, Glover. So three of us became very prominent in the same class. So you end up realizing that sometime the top brains goes in seasons. But then all of us, we didn't know that will come something, will become something. And then I went and did my specialization in ear, nose, and throat otorhinolaryngology. I started in UK for 2 years. And then when I could not get into the cycle of clinical training, then I came back to South Africa. And then I was trained. The only place where I could be accepted was University of Medunsa then, which is Sfagomakatu now. That's where I did my training. But I was the first one to write the College of Medicine of South Africa from Pretoria side. Because nobody, or in Transvaal, they were not writing those exams. They were writing so-called masters in the university. And then when I finished in 1998, then I decided to embark on PhD studies. And then my PhD study was on hearing loss. There's something called otosclerosis, where your bones, the 3 small bones, stop moving with no pain, no infection, nothing. They just stop moving and you just lose hearing. So I just got interested and I was stuck with it. And as I was busy with them, then the idea of innovation came in, and I realized, you know what, this thing can be done better, this thing can be done better. And in 2000, I qualified in 1998, and in 2000, I was appointed as the first South African black full professor in ear, nose, and throat in the All University of South Africa combined.
Wow.
And I was the youngest
Wow.
by that
Wow.
time. And people who appointed me, I think they took a lot of risk and faith, but simply because during my training, I did a lot of research and publication, so I was always very interested. But I never thought I'll become a professor. Only when I was finishing, I said, wow, it would be nice to become a professor when you're 35 years of age. And I let it pass. But the moral of the story is whatever you say with your mind, it come to pass.
Wow. Wow.
And when I got appointed, I was running a very busy private practice. And I said, if I stay here, I'll just make more money, maybe break more hearts, women's heart, and pay tax and all sorts of things. But that's all. But if I go back to teach and train, I'm going to multiply myself.
Yeah.
And then that's when I decided that I need to focus to train our local blacks, both male and female, because they were not trained by our universities. You know where we come from. It's the history that sometimes we are being told we must not talk about it.
Yeah.
But the religious book that we follow, or most of us Judeo-Christian, it speaks of that the generational wealth of any grouping goes for 400 years. So which means that if now we're just only 30 years, it means that the white people who have been, amassing this wealth of this country, they are still benefiting 400 years and will never catch up with them. So sometimes I hear people say, no, I said, are you serious? The people that we're living with now, they are still enjoying the wealth of their forefather of 400 years. We haven't done anything. So by that, then that's when I decided I'm going to empower our people with knowledge and teaching. So ever since then, I've been teaching, and I produce a lot of specialists, black specialists, and 5 of them, they are heading teaching institution in the country.
Wow.
So I have the first 3 ladies, head of the department, and another one male is a professor somewhere in Walter Sisulu. And he was my classmate at medical school. Very interesting.
Wow.
So just that I specialized before him, and then when he came back, I was his boss. Then I had to train him. So So that's how life is in myself.
And I guess, Prof, you've been an inspiration to many.
I've been inspiration to many, and you certainly realize that there's a purpose that God has called you for, and whatever you do, you don't do it for yourself, and you do it for a black child, because everywhere we have been stripped off. I'm sure we've been, if we talk of decolonization, we need to get a term to talk about what is it to take out the Africanism in us, that we don't appreciate who we are. And those people calculated and they did very well. Bantu education for those many years was very, very good. And I don't think it has stopped. It's just that it's in more sophisticated way.
Right.
We don't love who we are and appreciate what we are. And we are what we are because God has created us, and He realized that we are fearfully and wonderfully made as we are. So that alone makes me conscious of who I am in every corner, in every area, that even when I have to do something, I have to think twice to say, by the way, I stand for so many people who
Right.
look up to me. Those who knows me or who have personal encounter, but those who just know my name, they can name drop about Prof Mashudu Tshifularo, and they can talk about me with pride. So I need to maintain that at all costs.
So, Prof, and congratulations for doing that. You were one of 14 students.
Black students
Yeah,
in a
that,
class of 120.
yes. That must have been difficult to get in, but also then to stay the course and to finish. And at what point, obviously given your background for that time, in our lives, at what point did you realize that I think I can do this? And this might help somebody, for example, who's at varsity, who's at school, who thinks, if I don't see success signs now, that means that I'm not going to be successful. At what point did you realize that, you know what, maybe one day I could become someone?
I think for me, I might just say maybe it's inborn, but I think all of us we have, because when I was doing grade 5, which was standard 3 then, they used to ask, what do you want to become in the classroom? The
Yes.
teachers,
Yes.
just passing, and I stood up and said, I'd like to become a doctor. They said, no, you can't be a doctor. You're too stupid. And I used to beat your big brother, so you can't be a doctor. But the motivation for me was I was very sick, and I grew up being a sick child with tonsil, nose bleeding, infection. So I'll go to hospital, and you'll get these doctors who all of them were white missionary doctors in the public hospital, and the nurses here were black. And you can't be a child of 8, 9 years. You go to hospital and say, I want an injection, because you know that once you get that jab, it's going, in no time you'll be healed. So then, with all this suffering, I said, I want to make an impact and help people and relieve them of their pain and their suffering. So that's when I was doing that. So as I was studying, my mind was focused. I want to become a doctor. I want to become a doctor. I want to become a doctor. So when I got admitted at the University of Natal by then, of course, I could not go there at first year because I could not get a bursary. I did my pre-med at University of Venda and University of the North. Then they used to have pre-med. And then I just got an admission straight to second year. And you got that second year in medical school is the most difficult year in medical training. And I realized that we are few, and it is not easy. So all you do, you study, you eat, you sleep, You pray, you do a little bit of exercise, you go to university in January, and you come back in December. And you know that if you fail, you are going to be excluded. And the other thing was we used to get bursary from the Homeland system then. If you admitted in medical school, they were obliged to give you a bursary. So I knew that there's just no way. And the people said, "You are a bookworm." I said, "Yes, I'm a bookworm." But on top of that, I love studying, because everything about medicine from first year until I finished was always fascinating for me. Because I could not believe that you can study a nail and write a thesis and PhD on a nail or a hair. You know, anything, any part in the body, you can study in detail and be an expert until. So every year I was just said, wow, this is exciting. I could not wait for the following year because I was enjoying what I was doing. So my mind was, I just want knowledge, 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 knowledge. And even when I was studying, I was thinking, imagine my grandmother or my sister or my family or my community member comes in my community sick. What is it that I was going to do? So we had what we call ourselves, since I gave up hope, I feel so good. In other words, since I gave up hope to be called number one.
Yeah.
I feel so good. I'm starting to have all the knowledge, and out of all the knowledge, I'll have enough information to can pass an exam, because exams are written by people.
Yeah.
And my philosophy is that anything that is done by a human being, I can crack the code.
So
I have the ability.
let me take you back a little bit. In the village where you grew up, what has this done for them? You are now an African genius. You are now a specialist. You have 10 innovations. You still go back. You still see the people. What have your achievements done for people there?
Wow, it has encouraged them a lot that everywhere where I go, I mean, I get a lot of social media commentary and congratulation, and people feel proud, and people start to believe in themselves. So every time I said to them, it is not about me. Maybe I was just fortunate to open the door or to put up the ladder, but I'll keep the ladder so that all of you can climb and believe that you can climb. So believe in yourself. Of course, it has been very difficult. People will always make sure that they undermine your abilities, but believe in yourself irrespective of your color, because knowledge and intelligentsia is not based on the color of the skin. The
Yeah.
Creator has given all of us equally. I always love the words of Martin Luther King Jr., who said that, how do you tell the person to try to lift themselves up with the shoestrings, whereas they don't even have shoes?
Right. Right.
But the morale is that we have been deprived of an opportunity that, you know, we have to do with what we have. That's how we believe. I mean, you ask about the school. We have no toilets. We have no feeding scheme. We have no classroom. We're under a tree. But even then, we realize whatever little bit we used to get on the local newspaper, magazine, you know, now and then, and radio, one believed that unless I go to school, I won't become anything. My mother was very pro-education, and she said, go to school, go to school, go to school. In my mother's, we were 6, and all of us were graduates. And out of them, 3 of us were doctors and 2 professors. So we love school, and luckily when we went to school, you know, our brain cells were open and we could pass the exams. So it was...
Because you have such an exceptional ability, there is no way that you can say you told yourself that when you were in grade 5 you want to be a doctor, and you told yourself something and it happened because you told yourself. Fine, yes, it will, but to have 10 innovations, you must have exceptional talent beyond just telling yourself, look, I can tell myself I want to innovate something tomorrow, but it's unlikely to happen, even if I believe it. So talk to us through the innovations, maybe the ones that stand out and in particular for you, because when we did our research on you, we found that you have many firsts, things that have not been done by anyone in the world. So can you talk us through some of those?
I mean, the wise saying says that talent is not enough.
Mm-hmm.
So talent plus dedication plus hard work
Right,
will produce the results.
right.
There are many talented people
Yes.
who amount to nothing with all the skills. So whatever talent you have to sharpen it. I mean, I read books on daily basis, and I make sure I read one book a month on different things. You mentioned that I'm a pastor, I'm a reverend, so I've been ordained 3 times, and I've studied theology, because my understanding was I cannot be an academician and take religion or theology and don't study and analyze. I've done full study on how the Bible was written, how the Bible came about, how have we been made to believe what we believe. So now I'm more so-called 360 spiritual rather than religious, because religion is searching for God, but spirituality is connecting with the Creator. So when it comes to innovation, for me they come like drops of rain. They come when I least expect it. I can spend the whole night, like when I was in overseas now. I mean, the whole night ideas were just coming like this. When I went to work yesterday, I told my sister, I said, now we're going to do this operation differently. I said, with me, I don't do one thing the same way over and over. No, I must improve, and I must catch up with the momentum of the time and use what is around. So the main innovation that has made me to do a groundbreaking work, which I was already being aware, was the restoration of the smallest bones in the body, which are very, very important for us to hear. So as you're watching and you are listening, you must know that you cannot hear me unless the sound goes through the outer ear, eardrum, middle ear, where there are 3 bones that convert the sound into mechanical sound, and it goes into electrical sound in the inner ear and goes straight to the brain in a nanoseconds. So you don't get somewhere and you pause and you pause and you pause. And the more you discover, the more you said, the Creator is amazing. It's like a father who is playing with the child and he hides something and he just show you, you will find it and say, oh, I've discovered something. That's why we call it discovery. It has always been there. It's just that we're not looking. We did not create them. So ideally, scientists were supposed to be people who fear the Creator more than anything. So then when I was working, I realized that for almost, since 1952, nothing major has changed in the innovation of the prostheses that we do in the middle ear. And I've been working on this for almost 25 years now when I look back. Then I bumped against or into 3D technology in medicine. I said, let me try this. This thing can work. And for 3 years, I was working hard on it, working hard on it, working hard on it. The moment it happened and I managed to put it in the middle ear successfully, and carte blanche and everybody and social media, it was everywhere. Then I suddenly realized, oh, this is the first in the world. Because you'll go to conference and hear them talking and they're very excited about what they're doing. I said, but this thing is unintelligent. Can't we get better? So that's how it goes. So I work a lot with technology, 3D technology, and so research is just in my blood. Everything I look, I believe it can be improved and it can be changed and it can be made better. So 3D technology in the middle ear, nobody can touch me about it, and I'm the only one who knows it.
Wow. Congratulations. I think that's quite an amazing
Yes.
feat. And you know, many professionals, not just in the medical profession, they are quite happy to use what is available.
Yes.
They will not go outside of what is known or what they did last week, last
Yes.
year, or 10 years
Yes.
ago.
Yes. Yes.
So it's almost like a vicious cycle of
Yes.
the manner in which they treat their patients. So the
Mm.
extent to which you have been, you were able to actually say, it's okay, but it's not good enough. I want more.
I want more.
And where does that come from? Because I think many people would have been happy. Okay, when I was in grade 5, I said I wanted to be a doctor. I'm a doctor now. I'm a specialist now. I'm a professor now. I'm okay. But where then do you get that extra energy and that extra drive to go into an innovation?
I think for me, the idea of learning the history of medicine and realize that everything has always been a trial and error until we perfect it. So you'll find that we have things that we think they're the ultimate, but every time we say, no, 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 this doesn't work, let's improve here. That's why you improve everything, the cars, the cell phone, the cameras, everything we're improving on regular basis. But interesting enough, doctors or medical professional, they end up becoming static and just take what they're given. But there are those who are innovative, small percentage of them, they think out of the box. And so that alone, so every time when I operate, I look, I said, how can I do it more comfortable for the patient? I mean, one of the first things that I did was to do so-called bloodless tonsillectomy procedure. And it was the time when we were getting a lot of HIV infections, and most of ENT never wanted to do tonsillectomy because they say it's bleeding too much and they are going to get infection. So I said, what must happen to these patients? Then I designed a technique that I can remove your tonsil without a single drop of blood. So now you sit down. So that's one of the innovation. The other one is you use ear so-called cotton buds, which people call them earbuds, but those things are not designed to clean ears
Right.
because they are not they are not they are not anatomical aligned to the size and the shape of the ear canal, and they are too long. Many times I'll have the patient come and said, no, look, I was cleaning and the baby came and hit it and it went inside and break the eardrum. Or some they took the toothpick, or they use matchstick, or they use hairpin, or they use a pen. They use anything because none of those things are designed properly for that. So you see there's some innovation now. They will say, no, cell phone, look on the cell phone and clean. They don't understand that the ear is very sensitive in the inner two-third. You touch it, you jump. You clean it, you start to cough because there are very sensitive nerves there. So it's nice, yes, when they show you, but it can only be done by somebody who understands the anatomy. So I've designed something that's still coming. I'm presenting it to you as African Genius for the first time, that I've designed and I patented a self-cleaning device that will clean your ear properly, not too long, not too short, but take your anatomy as it is to make sure that it doesn't damage the inner ear.
Wow, that sounds incredible. We can't wait until that becomes
You'll see
available.
you'll see it coming very soon. And the other thing people don't like hearing aids, when they are
Yeah.
popping out and they complain about them, because it's not every hearing that need implant. There are different grade of hearing loss. So at the moment, I'm working on the hearing aid that you won't be able to even to see it. You just control it on your cell phone. Say, no, I'm on one-on-one, or I'm in a group, I'm on this, and then I'll be able to control it. Of course, you'll ask me, what about the battery? But I won't say it now in public, because people, they will say, oh yeah, that's what, no, I have it all sorted out, how we're going to have the battery. It will be for life.
Now that's really wonderful. And
So you'll be sitting here with a hearing aid, and you will never realize that you have it.
that's impressive. We wish you the best with that. I think it's another milestone. I think it's incredible that you used the 3D technology and did with it what you did.
Exactly.
But this one sounds simpler, but intuitively it is actually still fairly complex to achieve.
Exactly.
And the benefits thereof might be appreciated by many, many more people.
And I mean, with the AI, I mean, it's just sitting in front of you there. So I can see it. Sometimes I said, if I can get, people say we want funding, but you can have funding and you don't have an idea, and then you're going to waste that money. But when you have an idea and funding comes, you know what to do. For
Yeah.
me, funding comes, I know exactly what I want to do.
Precisely.
I know precisely what I want to do. And then one of the other one that I've designed, I'm sure I might have mentioned it somewhere. Things like female, protection or female condoms.
Mm-hmm.
I mean, it's one of the loudest things ever for years. It has never changed. When I did my training in the early 80s, it had always been the same. I say it's like just cutting a glove and put it on the finger. It hasn't changed. So I have 3D designed male and female condoms. And those are just, so when I look at them, I said, oh, wow, where do I get the money now, Because they are just out of this world. But the idea is that I want to give female or the right to decide how to protect themselves. Because at the moment, they don't have the right. Man has all the right. If men refuse to use a condom, the woman, she can't force, but now she will be in control.
Yeah.
She can put it whenever time she put it, and she can decide when she wants to take it out. But it will be so, the way I design it is something else. I look at it and I said, oh my God. So, there was a time where I was not pushing, but now I said, I need to push. This thing must come out.
Yeah.
So both male and female, they are really designed in a way that they'll protect you completely from any fluid or anything.
Yeah.
Nothing will touch you.
And there's no politics around that.
No politics. It's not a smell, say it's a banana, it's a strawberry. It's the same, it's the same glove, I mean, let's be honest.
Yeah.
It's the same glove.
No, obviously there's an expectation that the female condom would be designed by a woman and that the male had no idea what was going on.
No,
there.
but I'm a full medical doctor who understand the female anatomy, and I also collaborated with the gynecologist and the urologist. So the design is very different from what is there. It can be put in and anytime.
Well, maybe if you can give us free medical advice. Sometimes we all get a bit of a problem with our ears, and then you go to the chemist and you buy like this liquid that goes into your ears. Is that fine? Is that okay?
No, I think my advice is that the ear is a very special organ. apart from the eye. You know, eyes, you're separated from objects, but ear, you are living in a silent world, like watching a TV without a sound. And that organ is very sensitive, it's very special. So you need to know what you are doing and what you are talking about. The ear, you don't necessarily have to clean the ear. If it's not disturbing you, it's not irritating you, it's not causing you problem, leave it alone. It's like the eye. I'm sure you hardly put soap in the eye to try to wash the eye in the morning. No, because God has created it that way that it will clean itself. It's only when it starts to give problem then you know. So like for me, my eyes are very sensitive to bright light. So once I'm on the bright light, they start to tear. So I know I have to lubricate them. It's normal, I know about that. So the ear, if you have a problem with the ear, I always encourage you see a specialist or a general practitioner who can refer you to the specialist to make the diagnosis and get the proper treatment. Don't try to do your own homemade treatment. People do things. I've seen people putting things in the ear, acetic acid, or you know, there's somewhere where they say you light a candle and then it will melt out your wax and things. People have damaged themselves with all those things that are unconventional.
Wow. I know you're busy. When we met this morning, you were talking to someone who sounded like they were in theater and they were asking for advice. I was a little bit taken aback because I thought all the specialists knew what they were doing. They didn't have to ask for advice. I was quite impressed by that. So we won't take too much of your time. Just one final maybe comment on the intersection between, for you, between science and, you said, spirituality and not religion. They obviously are not mutually exclusive. They coexist within you quite comfortably.
Completely. For me, most of the time, even when I have a difficult situation, I will pray. I will ask my guardian angel. I said, how must I handle this situation? So even if I'm about to take you to theater to do a difficult procedure, if my spirit says no, not now, I can cancel you. It's not money, is what the spirit must align. So I reach a stage that in my spirituality and spiritual knowledge, sometimes I can say, please go and sort your things out and make sure that things are in order. I mean, I had one patient who came, as an example. That patient was persisting. I want to be operated, wanted to be operated. Then for 3 days, my spirit was sort of like unsteady. I said, what is going on here? Until I have to ask that patient, I said, who are you? That patient said to me, no, I'm a traditional healer. And I want you to operate me now. My spirit told me that I must come to you, operate me, I'll be fine. And I need to go home and continue to do my traditional practices. Then I said, my spirit was already told me that you are not ordinary. So I knew who you are. So now the issue was, do I proceed with the procedure or not? So I had to pray, and then my spirit said, no, please go ahead with the procedure. Everything will be fine. And definitely that's what happened. So I went on with the procedure, operate, and everything went on. I think being in medicine for many years, we suddenly realized that human beings are not just flesh and blood. A spiritual being. We are just God's
Profound.
workmans. God uses us to do things.
Wow. Profound.
So when I work on a patient, I mean, sometime, you know, just 3 weeks ago, I had one guy was sick and sick and sick. He came to me and I examined him. When I finished examining him, he said, Prof, what did you do? I said, what? I just examined you. He said, no, 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 no. Before I met you, I've been to 4 doctors and I could not stand. I could not do anything. After you touched me, I can walk, I can stand, I can do everything. What did you do? I said, I'm just a servant of the Lord. So I am a physician which is led by the great physician. So when my hands are working on you, the master is working through me. That is my personal. So I take it that way. And so they are not separated. They are, to me, they are intertwined. So even when the patient come, I can spend more time just talking to them, making them realize the knowledge that I know from the Western medicine. Sometimes I pray with them. I said, you know what, this need prayer. I'm not going to give you a medicine. Let's pray. Or sometimes I just touch them, and then the next minute they said, you know, I've been having all this medicine, and but after you talk to me, I'm well. I said, because I believe that by just speaking to you and touching you, you'll be fine.
No, thank you so much.
By the way, I also play music. I play saxophone.
Okay.
And I do cooking.
Wow.
And I do bird watching. And I do charity work.
That's incredible.
So, and I do stargazing. So at night we watch the galaxies. And during the day we watch the birds.
Wow.
And trees and animals. So when I want to really refresh, I must go to the nature, bush, water, animals, just sitting and look at them and appreciate what the Creator has done. It does wonders in my spirit and my innovation.
Wow, I think the recreational side of you is something that I didn't know about. Certainly, I think it's always worthwhile talking to you and learning so much about the things that you do and the things that you are.
Yes.
Congratulations once again on being an African genius. Your achievements speak for themselves. And thank you for coming to chat to us today. It was really wonderful to learn about the innovations that you've done and some of the ones that you're still working on. We would like to wish you success in everything that you are planning to do. And may that success exceed what you've already achieved to date. Professor Mashudu Tshifularo, an African genius, a pastor, innovator, scientist, surgeon, and everything else that goes with that. Thank you so much.
Thank you.
Thank you, Prof.
Thank you. I appreciate it. Thanks for the invite. And thanks so much for the award. I think it's a wind under my wings.
Yeah.
It makes me to fly more like
Wow.
an eagle.
Wow.
Well, even when I put my signature, I always say an African Genius Laureate.
Wow. Thank you.
So
Thank you.
everybody knows
Yes.
that is the first thing that comes.
But you can see from the evidence based on our criteria like problem solving, global competitiveness,
Yes.
you've done global first. That's globally competitive. That it's well merited.
So thank you so much.